Eric Feigenbutz is joining us now, and he is with Arizona Doppler Specialists. Eric, good morning to you.
Good morning. How's it going?
Well, pretty good. I'm kind of interested in what you're doing here, although I have to admit I'm a dummy and I don't understand it all.
Well, where should I start?
Well, let's see. First of all, you had an interest in medical imaging. In fact, you studied it and interned here in the Phoenix, Arizona area. What is chronic cerebrospinal venous insufficiency?
Chronic cerebrospinal insufficiency is a new look at an old problem. What it is it's a backup of blood in the veins of the head and neck due to a venous stenosis or abnormal valves. And that blood flows in the wrong direction of the veins oftentimes.
So your company, Arizona Doppler, uses some new technology, is that right?
Yes, it does. It uses ultrasound technology that's been around for years and years, but it looks at veins in a new way, a way that we haven't looked at before. The testing has been around for about 1 year. I did some specialty training in Buffalo, New York, by the leaders in the world for CCSVI detection. So it's looking at an old problem in new ways. It's something we've never done before. It's very interesting.
Is this a common ailment that you're testing for?
It's not very common at all. Actually, the ailment we're testing for is associated with people with multiple sclerosis. It's been shown that those people with multiple sclerosis have a high likelihood to have cerebrospinal venous insufficiency, and when that is treated, oftentimes their symptoms get better.
Well, I guess I was confused with the name Doppler because I usually think of that technology as trying to figure out how close the airplane is to the airport or how fast you're going down I-17. Is it some sort of reflection like the Doppler radar is?
Yes, it is. It uses the same technology. Doppler is used within our ultrasound machines to detect the blood flowing in the veins or arteries. So we actually use Doppler programs to tell how fast the blood is flowing in veins or arteries, and also to see where there's abnormal blood flow within the veins and arteries with non-invasive ultrasound.
So once you see that, how do you make it flow in the right direction?
Well, we don't make anything flow with the ultrasound in the correct direction. We just detect abnormalities. When an abnormality is detected, then the patient is referred to a surgeon or an interventional radiologist who can do what's called a venogram, and it's a very non-invasive procedure where they put a catheter in a vein, usually in the groin, and they feed that wire, that catheter, up into the neck veins where the problem may be. What they do at that point is they can expand a small balloon inside the vein to stretch out the vein to make the blood flow in a more normal pattern after that vein has been dilated.
I'm assuming that most of your business comes from referrals as well.
It does. Most of our business comes from referrals. It's interesting. A large number of our patients that we see now are coming down from Canada. With their healthcare system, the physicians up there are not allowed to do the testing and procedure that helps with CCSVI. So a lot of patients, I would say 75% of my patients for CCSVI come down from Canada to get the procedure done by me and the people I work with.
Eric, how can we find out more information about your company? You have a website or something we could check?
Absolutely. Arizona Doppler Specialists, or you can look onto my website, www.azdoppler.com.
All right, very good. Eric, it's fascinating stuff you're doing there, and we appreciate you joining us on the show this morning.
Thank you so much.
Eric Feigenbutz there, the president of Arizona Doppler Specialists.